Hello viewers, please subscribe the channel, like the video and share it. Thanks.
Before starting the video, please understand the anatomy of the female genital tract. In the picture, number 1 show the uterus, number 2 show the bladder, and number 3 show the ovaries. So this is the basic anatomy of the female genital tract. So we have to talk about the ovarian cyst today. In the picture, you can see the urinary bladder, anteverted uterus with the endometrium, and adnexia. So this is the live case about the anatomy of the uterus. This is the pelvic ultrasound of a 25-year-old female with the AV uterus, anteverted uterus, and this is the measurement of the uterus in the craniocardial and the transverse position. Normal size of the uterus vary from 8 into 4 centimeter. You can see the bladder in front of the uterus. So this is the normal anatomy of the uterus. You can see the ultrasound pic of the uterus. When you understand the anatomy of the female genital tract, you can detect the abnormality within the genital tract that could be in the form of ovarian mass, uterine mass, or something else. So coming to the live case, this is the ultrasound scan of a 32-year-old female. She has C-section few months back. Now she present with the pain in the lower abdomen, especially on the right side, and with the bladder filled. When you do the ultrasound of the pelvis, you can see the AV uterus that is bulky, and this is the measurement of the uterus in the craniocardial and anterior posterior position or transverse position, that is about 7 into 5 centimeter or 7.5 into 4.7 centimeter. You can appreciate the bladder in front of the anterior wall of the uterus. Now, on manipulating the probe of the ultrasound, you appreciate the cystic swelling on the right adnexial position. This is the right adnexial cyst that is thick walled, and it is about 6 into 4 centimeter in the measurement. So you can appreciate this thick walled right ovarian cyst. The cursor shows the boundary of the cyst. It is somehow ill-defined. On the power ultrasound, you can see there is no blood flow. So this is a sign that usually show the benign nature of the ovarian cyst. But if the patient is 30 or 35 year old with the thick walled ovarian cyst, we should do, or we must at least have a CA125 marker result. Look at the endometrium of the uterus. It's about 4 millimeter. You can also see the cervix, that is about 2.5 or 2.7 centimeter in its measurement. The cysts are very common in young female that are in the age of reproduction or reproductive age. They are very common in young adult ladies before marriage or even after marriage, and they usually cause heaviness and pain in the lower abdomen that can mimic acute appendicitis as well. Because on palpation of the abdomen on the right side, there is tenderness as well. Or when you do the ultrasound, you usually find the cystic swelling or mass in the right iliac fossa rather than streaks of fluids in the right iliac fossa. So this is the urinary bladder that is thick walled. Thick walled urinary bladder show the UTI or the cystitis. You can also appreciate the liver and the kidney on the right side to see any abnormality or any significant pathology. You can also appreciate the kidney on the left side along with the spleen that appears to be normal. So the cause of the pain in the abdomen, especially on the right side of this lady, is due to cystic swelling in the right adnesia, and if it is not relieved by the medication, she usually or the patient usually ends up with operation in the form of right ovarectomy plus oophorectomy or simple cystectomy. So this is very good case. Thanks.
Thanks for watching the video. Please like the video and share the video. Thanks.